and welcome to Veterans Health Today, where we discuss the many services offered by the Dayton VA Medical Center. I'm Rhonda Moore with the Dayton VA Public Affairs Office. Dayton is home to not only one of the oldest VA campuses, but also a state-of-the-art medical facility, offering top quality care to those veterans in need. Our heritage dates to President Abraham Lincoln, who signed legislation creating our campus and what's now the modern VA. Our mission comes from his words, to care for him who shall have borne the battle. We continue that tradition today through the employment of modern medical services, many of which are geared to the special needs of our veterans. We have with us one of the many professionals dedicated to serving our veterans, Bobette Hart-Nelms, Chief of Social Work with the Dayton VA Medical Center. Bobette, thank you so much for joining us for our first show.
Thank you for having me. I'm excited to be here.
Tell us a little bit about yourself.
Well, as you said, I'm the Chief of Social Work at the Dayton VA. Prior to that, though, I've worked for the VA for since 2007. I have been at several VAs, one at the Prescott, Arizona VA, and another at the Washington, D.C. VA. But more importantly, I love taking care of veterans, and I am a social worker at heart. And I became a social worker because I believed that given opportunity, anyone can change their life if they are given the right tools. And so this is what I'm doing at the VA, changing lives every day.
Oh, that sounds great. Tell us what are some of the programs that you actually oversee at the Dayton VA?
So the social work services is kind of broken up into two services. We have the mental health social workers, and then we have the social work medical social workers. And I am over the social workers that take care of the medical piece. And so I am over the inpatient units, which is acute and extended care. We also have ambulatory social workers, which is our outpatient social workers. We also have our intimate partner violence social worker, and we have our Fisher House, which that is part of the social work services. We also have our caregiver support program. So those are our programs, and we have social workers embedded in all of those programs.
You also have social workers embedded in extended care.
Yes,
as well.
extended
care. Talk about that a little bit.
So extended care is what we call our long-term care. Long-term care is where a person would go and stay, you know, the remainder of their life. We have what we call a CLC. And the CLC is our community living center. And the community living center is where our veterans will come and stay. You are eligible if you are a VA employee for the community living center. We also have what we call rehab. If a person just needs short-term stay, if they've had a knee replacement or some type of surgery where they are debilitated, then they will have short-term rehab. So that's also part of our extended care. Then we have hospice, inpatient hospice, where a person would go and for the end of their life care services, and that's called Victory Ridge. And we have social workers embedded in all of those areas that will help them and the families transition into that care.
Tell me again, who's eligible for extended care?
Anyone who is eligible for VA care, and if we have long-term beds available, then we will work hard to get them into our community living center.
Now, there's also extended care and also acute care. So what is acute care? What's the difference between the two?
Now, acute care is more immediate need. If someone came to the hospital and they were put in an acute care bed, that is some services that you cannot get an outpatient. So that means needs immediate care. So we have several floors for acute care. One is SAM, one is Med 1, and that's where you would get your immediate care, then you would transition home. We have social workers who will help you discharge to home after you have surgery or after you have some type of, you know, small medical incident or anything like that. That's an acute care emergency need. Our social workers will help you discharge home.
Now, if someone doesn't understand what SAM or Med 1 means,
okay.
What is that?
So medicine floor is Med 1. That's the floor where you'll get all your medical care. Everything that you need, that's acute, that's right away. That's where you'll get that kind of care. SAM is more of a medical floor where you're having short-term stay there, where you will be getting, participating in rehab, physical and occupational therapy.
How does social work play a part in those units?
So what social work does is they're like the liaison between the family and the doctor, the family and the patient. They're making sure that the patient has everything they need to discharge home. So social workers link families up with resources. They help the veteran to decide, or if they have to go to a long-term care center and the family wants them to be in a community nursing home, they make sure that the family have the information they need to make a safe discharge.
And what role does a social worker play with medical providers?
Okay, with medical providers, they're there to be the go-between between the family and to help the medical providers with resources, to help them to determine, sometimes they want to know what's available in the community for this patient, or what can we do, or what is the family saying about this, that, and the other. So we're kind of like the go-between and the liaison between the patient, the family, and the doctor.
One thing that I've learned since being there at the VA is there's pretty much social workers almost in every service, in every department at the hospital.
Yes, yes, we are. We're everywhere. We manage the most difficult cases. We manage anytime that a veteran has a condition or a situation at home, psychosocial issues, they don't have food in their home, they need assistance with home health care, they need assistance with, or linking them up with any type of services in the community. The social worker is there. If they need adult protective services, sometimes we're the go-between between adult protective services, the doctor, and the family. We try to make sure that the veteran is safe when they're discharging home. We want to make sure that no stone is left unturned when we work with veterans.
How many social workers do you have at the Dayton VA? And I can say, just from talking to so many of them, they really seem to love their jobs.
So we have approximately 45 social workers at the Dayton VA, working between social work and mental health.
Bobette, thank you so much for sharing just how vital social work is at the Dayton VA. We appreciate what you do and all of the other social workers.
Thank you.
And we'll be right back after this break.
I'm good.
I'm good.
I'm good.
I'm good. But I have a story, and I don't know where to start.
I'm good. But I feel alone in a crowd.
I'm good. But nobody understands.
I'm good, but the past keeps coming back.
But I can't get out of bed.
And I can't sleep.
I'm good, but I feel overwhelmed.
I'm good, but I don't feel safe.
But I don't even know who I am anymore.
But I still have nightmares.
But I don't need any help.
I'm good. But I don't feel anything anymore.
I'm good. But I can't live like this anymore.
I'm really not so good. But are you ready to listen?
It was a different time when I served. I felt confident in the work I did.
But when I came home, I felt lost.
When I retired and had all this time on my hands, lots of bad memories came back.
Whatever you're dealing with, there's someone to help.
If you're going through a rough time or having suicidal thoughts, call the Veterans Crisis Line.
A lot of us had trouble when we got back, adjusting to family life, and our jobs.
Order up.
When I want to give up, I try to focus on getting to the next minute, then the next hour, and the next day.
It might not seem like it right now, but there are people out there like me who want to listen and support you for the long haul.
And I found someone to talk to, someone who listened.
You are not alone.
America's veterans have sacrificed so much to protect our freedoms. And we need to show our gratitude. But how? Well, we can volunteer at a VA medical center or outpatient clinic, at a VA community living center, a veterans benefits office, or at one of our national cemeteries. We can also contribute online to help support veterans programs. Let's show our nation's heroes just how much we care. Volunteer or donate today to thank America's veterans.
Our veterans need you.
There are more than 8 million enrollees in healthcare at the Department of Veterans Affairs.
That's more than 2% of the entire U.S. population.
This includes veterans from previous generations and veterans from today's wars.
Challenging medical conditions, ever-increasing technological breakthroughs,
and more returning women than ever before
are redefining the type of care VA professionals are providing. Serve those who served our nation.
Provide patient-centered, evidence-based care.
Bring your exceptional medical and healthcare skills to the Veterans Health Administration. America's heroes need you. Join the conversation at #WorkAtVA or visit vacareers.va.gov.
All of us want to make a difference. As veterans, we committed to protect our country. We served and sacrificed for the things that mattered most. Those experiences shaped our lives, even if it isn't always obvious to those around us. And now that we've served, our commitments have taken on a new meaning. We're husbands, wives, parents, friends, and neighbors, but sometimes we still feel alone. We forget that our biggest challenge can be to ask for support when we need it. The Veterans Crisis Line is here for all veterans, service members, and their loved ones. Dial 1-800-273-8255 and press 1. Chat online at veteranscrisisline.net or text 838-255. It matters.
Welcome back. We are talking with Bobette Hart-Nelms, Chief of Social Work with the Dayton VA Medical Center, about some of the services offered to our veterans. One of the lesser-known services offered on the campus is provided by the Fisher House. Bobette, tell us, what is the Fisher House?
Oh my goodness, the Fisher House is such a beautiful place and establishment. It is set up for the veterans when they live 30 miles or more away from the VA and they're having a procedure. Any kind of procedure. As long as they live 30 miles away and they have family members that are coming with them, the Dayton VA will provide housing for them free of charge.
And that housing is at the Fisher House?
And it's at the Fisher House, where we have 16 rooms. And we provide lodging, food, and comforts for the veteran and their families while they're going through whatever procedure, or if they have family members that are coming to visit their loved ones in the hospital or they're in hospice, they can stay there for the whole episode of care.
Is this to make it easier for the family members, like they can just go over to the hospital, go to the Fisher House, they don't have to worry about driving far?
It takes the burden off of the family. When a loved one is ill or sick or going through a procedure and someone is driving a distance, and you know, a lot of our veterans are elderly and it's difficult for their loved ones to get back and forth, this will provide comfort for them where they can visit the veteran, come back and stay and rest, and as long as the episode of care is going on, they're free to stay at the home.
Meaning they can stay as long as necessary?
Long as necessary. If a patient is having chemo and he has 6 weeks of chemo, family members are welcome to stay.
Is there an age limit on who can stay at the Fisher House?
Yes, there is an age limit, and you have to be over 18 years old to stay at the Fisher House.
How does someone get the approval to stay at the Fisher House?
So the provider, the social worker, or anyone will put in a referral. The referral will come from the doctor, or the referral will come from the social worker, stating what the need is. And once they receive that consult or the referral, then a Fisher House member will call, and they will talk with the veteran and explain to them, or talk with the family and explain to them, everything about the Fisher House, and then it's set up. It's very easy and very simple. As long as all of guidelines are met, then there is no problem at all.
And again, this is free.
Yes, it is free.
And did you say if the food is free, or do they have to provide their own food?
Well, what we do is provide food for them, but usually they can, buy their own food, but we get a lot of donations at the Fisher House. And so usually there's always food there, and Fisher House guests are allowed to cook in the kitchen. They're allowed to eat any food that is there. Sometimes, different agencies bring food over for the family, so there is always food there for them to eat.
And besides the fact that it could be a long drive, what are some of the other reasons why someone would want to stay at the Fisher House?
Well, if their family is, if their loved one is in hospice, if they have hospice care and they live a distance, they can come. Or if they're having surgery, they can come and stay in the Fisher House. Or if they have an appointment overnight, or if they are receiving blind rehab, or any care that's going to bring them there, that they have to stay overnight or have an appointment the next day, because sometimes they're coming from a distance and they have a morning appointment, and so they can stay at that point because it's too far to travel to get to the 8 o'clock appointment, so therefore they can stay the night before. So there's multiple reasons, and we try to make sure that we meet every veteran's needs.
So does the veteran have to be staying at the Dayton VA hospital in order for the family to stay at Fisher House?
Absolutely not. If they have a appointment at a community hospital, they can definitely use the Fisher House.
So Bobette, we understand now how someone can stay at the Fisher House, and we understand all that now, but kind of go back a little bit and tell me, how did the Fisher House get started?
So the Fisher House got started by the Fisher family. The Fisher family really wanted to do something for our veterans, and they wanted to do something for the active duty members also. So Bethesda National Naval Medical Center is one of the first Fisher houses that was put up, and it was for families who were coming to visit their veterans that came in from Landstuhl. And they weren't veterans, they're active duty members who were coming in from Landstuhl. And so they figured that this would be a great way to take care of the families also while they were taking care of their loved ones in the hospital. So the Fisher House has a rich history with taking care of active duty members. It also has a rich history with the VA. So that is how the Fisher House got started, just making sure that we were able to take care of family members of veterans who were hurt and harmed. And now we do the same thing for veterans who are, receiving medical care at the VA.
And we're fortunate because we have 2 Fisher Houses in this area.
We have one at Patterson Air Force Base, and we also have one at the Dayton VA.
And let's say at the Dayton VA, the Fisher House was full. Could someone stay at the one at Wright-Patt?
Yes, they can. And we would work with Wright-Patt to get them, set up and linked with the Wright-Patt Fisher House.
And what role does social work play with the Fisher House?
Well, the Fisher House is under the social work aspect, so I'm the manager of that, but we have Betsy Strebo, who's the program manager of the Fisher House, and so we have social workers who provide the referrals for Fisher House, and they may put that in, or the doctors may put it in, or the nurses may put it in, or the nurse of the day will put it on, anyone can put a referral in for the Fisher House.
The accommodations are extraordinary, exceptional, beautiful.
Yes, yes it is. It is such a beautiful place, and we have had nothing but rave reviews about the Fisher House. And the veterans really love it, their families really love it, and so we are so glad to have a Fisher House on the VA campus.
Bobette, thank you so much for giving us all of that information and sharing your time with us and telling us about your role at the Dayton VA. We really appreciate it. Now, if you know a veteran and the veteran is not enrolled with the Dayton VA Medical Center for health care, we'd like to help. It's easy to apply. One way is to visit the Dayton VA and stop by the Enrollment and Eligibility Office. They will be glad to help walk you through the process. You may want to call first to schedule an appointment, and that number to call is 937-268-6511. That's our main number, and the extension is 5336. Now, they will tell you what documentation you'll need to bring with you to determine eligibility. You may also enroll online at va.gov. Veterans may also call the National Call Center to apply. That number is 877-222-8387. And finally, veterans may mail an application directly to the Dayton VA. You can also enroll in person at surrounding community-based outpatient clinics, also known as CBOCs, and they are located in Lima, Middletown, Richmond, and Springfield. We hope we've shed light on a few of the ways the Dayton VA is working hard to provide the best health care possible for our veterans. Thank you for spending time with us to learn more about veterans' health today. And to our veterans who are watching, thank you for serving a grateful nation. We'll see you next time.